Hi, I'm Dr. Ben from Mornington Peninsula Chiropractic Centre, and today I wanted to talk to you about one of the common questions I get, and that's about spinal discs, in particular cervical disc problems. That is, problems where the disc is involved at the neck level. You see, the spine is made up of vertebra, and in between each vertebra is something called a disc. And the disc is like a shock absorber. But not only is it a shock absorber, it's something that keeps our spine incredibly stable and allows our spine to deal with the stresses and the loads and the jerks and the jolts and the things that we subject it to every day. But sometimes due to poor lifestyle choices, that is nutritional choices, smoking, poor posture, lack of exercise, etc., the discs can actually start to break down. They start to, if you like, perish. And as the hard outer fibers of the disc start to perish, the soft gel on the inside can actually squirt into some of those perished cracks, if you like, and cause a bulge. And as the disc bulges, it starts to compress or choke on the delicate nerve roots that exit from the spine. And over time, that compression can start causing radicular pain, often down the person's arm. So there's lots of different levels in the neck, but to give you an idea, the disc between the C4 and C5 vertebra, if it gets compressed, it'll often cause some localized neck pain and often maybe some pain out into the shoulder region. Often there's no change in feeling in the hand or necessarily lack of strength, but we'll often get some discomfort out into the shoulder. The next level, C5-6, which is often a common area where the disc can bulge, will start to cause some pain out into the biceps muscle and sometimes some pain out into the outside part of the forearm and into the outside part of the hand. Sometimes you can also get some weakness in the bicep muscle when that nerve is being compressed. The next level is C6-7, which is a nerve that passes down into the arm and can often cause some pain or discomfort again in the triceps, some weakness in the muscle here, and possibly some pain down into the middle finger and back part of the arm. And then lastly is the C7 T1 disc, and if that gets compressed, often again you'll get some pain down into the forearm, but often it's on the outside of the hand. So you can see that each different level of the spine can produce different types of pain, and often the pain is somewhere located in the arm. Now there's different types of treatment for cervical disc problems, and one of the most common and most effective treatments in the early phases is, of course, chiropractic therapy or chiropractic treatment. And so what we do as a chiropractor is we try and restore normal biomechanics or joint movement to the vertebra within the neck. And by improving joint movement, we help relieve some of the pressure that's being applied to that disc and allow it to restore some level of normal function. Often at the same time of treating the spine chiropractically, we're trying to reduce the inflammation. Because when a cervical disc problem occurs, there's an incredible amount of inflammatory change that occurs around the disc and around the nerves. And so often some anti-inflammatory therapy, and whether that's localized ice or something more aggressive like anti-inflammatories, non-steroidal anti-inflammatories, or even steroidal anti-inflammatories like cortisone may be used to help significantly reduce the amount of inflammation. Now this, of course, doesn't fix or actually affect the disc bulge itself, but it helps relieve the symptoms and gives us a window or an opportunity to treat the patient, make the patient more comfortable throughout the treatment cycle as we improve that spinal disc. So I hope that explains a little bit about cervical or neck spinal disc problems and the effects and the pain that can be caused down through the arm and some of the treatments that are available. It's very important that a proper examination is done, because in the cases of some cervical discs, it is beyond the scope of manual therapy, chiropractic, beyond the scope of just some drug therapy like anti-inflammatories, and actually may require spinal surgery. So your chiropractor is best placed to examine you and to make those decisions in accordance with your wishes. So please do get examined if you're suffering ever with neck pain, in particular if the pain is going down the arm, because it may indicate the presence of a cervical disc problem. Remember, always look after your spine. I'm Dr. Ben from Mornington Peninsula Chiropractic Centre.